partner with initiatives that are happening here at Wake Forest University as well as across the country. So, let's get started. So I think a lot of you all already know this, but just want to reiterate that there is a lot of stigma around HIV. That's probably the most challenging hurdle that we will continue to overcome as we work towards ending the HIV epidemic. And unfortunately, over the past 40 years, the stigma
I'm going to show you the
around
parlor
HIV
that
really
I use for listening
have
sessions,
a
but
stronghold in faith communities.
I'm still
There's
trying
a
to
lot of
get signed up
silence,
for listening
anti-gay
sessions. I figured out
messaging
30 minutes,
in faith
20 minutes break
communities,
in between.
framing HIV as a sexual
I got them
orientation
printed up the last
issue
one,
or a
so
sexual
folks will be
morality
able to
issue,
sign up. So I'm
and
thinking
shaming certain
you'd be
behaviors
out
and
here,
distorted
and
interpretations of
give some
scripture
vibes,
and theology.
they'd like to
And
listen
so
to
these
or
are things that oftentimes make
and then I'll
people
show
who
you
are
what
living with
parlor
HIV and
is.
those who are vulnerable to
Rather than
HIV
putting
to
you where
feel
parlor is, then I
marginalized, feel
Yeah.
excluded in faith communities and feel rejected.
I'm
So that then also leads to them internalizing much of the stigma around HIV. And so what we're here today to think about is how do we challenge some of those mechanisms that are happening in our faith communities. There are some practical ways, and I'll go into some deeper things that our center is doing that we would love for you all to get involved with. But even if you didn't get involved with us, these are things that you can implement in your faith communities now. Supporting candid, institutional, and community dialogue about sexual and reproductive health. We actually just went to a very large community event in Durham, North Carolina, and did some interviews with people on the street, just kind of asking, what would you want to hear from your faith leader about HIV? And most of them said they'd never heard anything about HIV from their faith leader, and they wish that they had heard some type of guidance on how to live as sexual beings, right? Like how to integrate their spirituality with their lives as adults and their sexual beings, right? And so a lot of times as adults, we're taught to separate our spirituality and our faith from who God made us to be. And so as sexual beings. And so having those open, honest conversations about sexual and reproductive health is hugely important, especially now as we see movements to dampen access to reproductive health. Host HIV discussions and settings inside and outside of faith gathering spaces, create an HIV or social justice ministry. I think a lot of times, over the past 40 years, there have been a lot of faith communities who have had HIV ministries, but a lot of times they've fallen by the wayside or lost steam. Many people are living long lives with HIV now, and there's not kind of this urgency due to people dying from complications with AIDS. And so a lot of faith communities, even though they had the ministries in the past, have lost steam around them. But there is still a need for us to have some type of engagement around this conversation, even though and what's interesting is that the rates are actually going down in the United States, which is a great thing, right? But in the South, they're going up. And part of the reason why in the South is because of the stigma and also lack of access to resources. It's very difficult for people to access health care, in many rural communities. To think about Winston-Salem, where I live now, and there's the highway that went through, that basically displaced 600 black families. It went through the black neighborhood, right? And it was for urban renewal. But then that cut off their access to downtown, to employment, to food, right? There's only one grocery store that serves like 10,000 people on the east side of Winston-Salem. And even though the hospital is only 2 miles away, it could take them up to an hour by taking a bus or by walking, right? And so that's what we're talking about. We're talking about why, those are many of the structural reasons why HIV is becoming more prevalent in the South as opposed to going down around the country. Social media outlets, using social media. A lot of people are afraid of social media, but we at the Wake Forest Faith Coordinating Center are here to help build the capacity of faith communities to learn how to use social media and learn how to use other communication channels to advance communication and amplify these messages around HIV and other messages related to that. Engaging the other forms of traditional media, TV, radio, newspaper, magazines, blogs, work with other faith leaders, as you all have already kind of jumped on that bandwagon, and convening regular meetings with diverse and interfaith leaders to discuss HIV/AIDS. So why are we talking about this in the context of faith communities? In addition to the stigma, it's because people living with HIV hold their faith to be very important to them, and it is one major way that they're able to move forward in their lives and to gain some type of hope after being stigmatized and potentially rejected in their communities or their families, right? And so faith is that central kind of pillar that keeps them going. And it's true for 75% of African Americans who also say that religion plays an extremely important role in their lives. I think this is an important trend also to point out is that a lot of times African American communities get pegged as particularly anti-gay, but it's not necessarily true. They're not more or less than any other group. And the trends are continuing to become more and more tolerant as we go through generations. So actually over the last 10 years, it's the attitudes towards same-sex marriage in the Black community has increased from about 30% acceptance rate to over 60% acceptance rate in the last 10 years. And that's even higher among millennial and Gen Z groups. So what we really are here to talk about is kind of this overlapping connection between social justice and what we call intersectionality. So intersectionality is race, class, gender, and sexuality. So thinking about how all of those overlapping experiences, identities, and systems of oppression impact people's lives. You can't just go in and talk to them about HIV. You have to talk to them about what most people actually, I hate to be brass like this, but most people don't care about HIV. So what do we do when we're going in to try to get people to talk about it? Is talking to them about the other things that do matter to them, right? The social justice components, the talking about gender and violence against women, and intimate partner violence, right? Talking about how we can deal with trauma and mental health, right? And so those things, and access to healthcare and resources, those are things that all matter to all of us, but they have a particular impact on people living with HIV, who I would argue are some of the most vulnerable people, most marginalized people in the world, similar to what we would think of as lepers in the Bible, right? And so we have to be, as people of faith, conscious of how all of those systems are particularly impacting people of color and people living with HIV. So our mission at the Faith Coordinating Center is to transform the story of HIV/AIDS in faith communities to respond to the crisis in the South and promote positive health outcomes. So we are challenging stigmatized faith-based narratives about people living with HIV and those vulnerable to and affected by the disease. So even if you don't have HIV, there are many in our communities that are still vulnerable to the disease. And so it's still worth talking about. Even if you don't think that there's one person in your congregation that has HIV, there's many people who are still vulnerable. Now I would even argue that myself, I think it took me a while to figure out, to even identify with being vulnerable to HIV. But as a Black woman in my 30s, who is dating, right? And who has been in an intimate partner domestic violence situation, like these things happen, right? And a lot of times we're not taught in the church how to deal with these things, is silence around it. And so then I was in a situation where I didn't know how to get out of it. Even though I grew up in a two-parent household, my parents loved each other, they loved me, I didn't have the tools to manage that. And so that's what we're talking about. It's even people who you wouldn't on the surface think are vulnerable are vulnerable. So our values, holistic approach, we believe that in order for us to achieve healing, transformation, and wholeness, we should celebrate all faith traditions and belief systems. We should integrate mind, body, and spirit approaches for transforming and eliminating HIV stigma. So not just talking about the science of HIV, right? Typically in public health, a medical doctor would come to you and just talk about the science of HIV. But what we're doing is also integrating, talking about the wholeness, talking about the spiritual components that also tie into that. And then expanding the capacity of faith communities to enhance emotional, physical, financial.
So it's okay to grab a bag? Yes.
Yes, yes. You take pictures of like, what did you slow down? Okay. So our faith coordinating center is a part of a larger $100 million 10-year initiative from Gilead Sciences, which is amazing. Yes. Yes. So Gilead is a pharmaceutical company that manufactures HIV drugs, and they've been instrumental in kind of changing the trajectory of how the HIV epidemic is handled in the United States and around the world. And so they've been, had the foresight to know that they needed to infuse dollars into the South in particular, and into Black, Indigenous, and Latinx-led organizations in the South to address the HIV epidemic. And so, okay, I am going to go over some basics, just because I want everybody to be on the same page about it. So, HIV 101. How can HIV be transmitted? Somebody raise their hand. One. Sexual contact is up on the screen. Cheek, injection drug use, blood transfusion, urban Hannah. Mothers to baby during pregnancy. Yes, birth or breastfeeding. Fortunately, in the United States and actually in Cuba, ironically, the mother-to-child transmission is extremely low because women can take the HIV medication and reach an undetectable viral load and not pass it on to their child. So that is a wonderful advancement. It cannot be transmitted by air or water, saliva, sweat, tears, or kissing, insects or pets, sharing toilets, food, or drinks. So I can come give someone a hug, and we're all good. All right? So the ways to protect yourself, of course, get tested, know your status. Use condoms the right way. Condoms are not 100%. They're about 85% protective with typical use. Choose activities with little to no risk, like oral sex. Don't inject drugs or share needles, syringes, or other drug injection equipment. So I know we're in a harm reduction community here, so I would argue, make sure that even those who are using injectable drugs are using clean needles, and that severely reduces that risk. If you do feel like you're at risk, there is a medication called PrEP. It's pre-exposure prophylaxis. Basically, taking an HIV pill that will prevent the virus from infecting the immune cell that would then replicate and spread through your body. So it protects people from getting HIV up to 99% with perfect use. So it's a daily pill that you can take. They also now have what they call a long-acting injectable. So someone could take the injectable form of that medication and other types of medication, and it would last for a month, up to 2 months. And so that's been a new innovation. It's not as widespread use yet, but it is something that is on the horizon. Okay, I'm going to move on because I have a lot of slides. So what are the symptoms? What are symptoms of HIV? Chills, fever, Ms. Suzanne, lymph nodes, I can't see your brain, pilar, headaches, night sweat, sore throat, muscle aches, joint pain, fatigue, swollen lymph nodes, and mouth ulcers. Yeah, kind of like them. Yeah, so many people don't experience these symptoms, or they may not be severe, and oftentimes these only last for about two weeks, and then they go away, and people don't. They're like, oh, I guess I had the flu, and then it went away. But so a lot of people don't know that they have HIV because these symptoms only last for so long, and then they think that they're fine. Yeah, so it's important for people to go get tested. So acute HIV is like when you have those flu-like symptoms. This actually is a crucial time because it is probably the most infectious time, and also it is probably the best time for someone to get on treatment. We're starting to learn through research that the earlier you get on treatment, the better it is for your medication to be able to control the virus and to stop it from spreading into certain parts of your body, like your lymph nodes and brain tissue and other areas that are much harder for it to get out of. Chronic HIV is when someone has been living with HIV for longer than 2 weeks. No, for a long time. And it can be known as latent or asymptomatic stage. So like I said, people have HIV and they don't know it. It can progress to AIDS. So a lot of people use HIV and AIDS interchangeably, but they are two different stages. So AIDS is when your CD4 count, CD4 is basically a type of immune cell. When that count goes down below 200 cells. Typically we have, I don't know, like 2,000 or more CD4 cells in our body. So if it goes below that, then you're severely immune compromised and susceptible to infections. And so when we say someone has died from complications with AIDS, they're not actually dying from AIDS, they're dying from infections that they got that their immune system could not fight.
So that means when people get a cold and you always say that, I know the guys from AIDS, but you always told me
yeah, so that's probably more stigma than people not wanting to admit that they had AIDS. Yeah. So her question, and they're recording, so I want to repeat it for the camera. Her question was that why do people sometimes say that someone who died from AIDS died from the flu? And some of it is stigma. People don't want to acknowledge or publicly declare that someone died from complications of AIDS. But to your point, they could have had the flu, and because they had AIDS, they could not fight it off, right? But a lot of times people say, oh, they got cancer or something like that also, and that oftentimes is not the case. But also, people living with HIV do actually also have a close tie with cancer. Many of them do develop cancer. And so now there's a lot of research that's looking at the connection between cancer and HIV and using the same drugs that are treating cancer for HIV and also vice versa, that the drugs that they're using to treat HIV are also being used and shown effective at addressing certain types of cancer. So that's why people should care about it, right? It's not just caring about people living with HIV, but it also has implications for so many other things.
Now, are you saying if you take the medication while you are in the HIV status, that you're able to possibly prevent HIV?
Yes. So if you get diagnosed with HIV, or even if you get start taking medication, it will prevent you from going to the AIDS status. If you have AIDS or the AIDS status, you can take the HIV medication and rebound and go back to what we would call a more stable condition.
So that would be the HIV virus instead of the actual AIDS, right?
Yeah, the virus, HIV virus, develops into AIDS. But AIDS is not a different virus.
It's probably been about 10 years ago, all the family was called in for him. And so we went to see him, oh my gosh, he was slender, he had only like bones and maybe a little skin stretched over it. And so he was sent to a hospital in Charlotte, and there was a doctor from Africa there. And I don't know what it was that she gave him, but he's thriving now. He looks completely different than what he did then. I mean, he has a family, but he has a female companion now. And they're on the stages of getting married, but he, changed so completely. Laying in that bed, he looked like a Holocaust survivor or someone that had cancer in really bad stages. And now he looks so healthy, and he's healthy, but I think he said he takes a cocktail or something. So, well, I don't know if that's reverse it, but he doesn't look like he has no AIDS.
I'm so happy that your family member is moving towards marriage and a loving relationship. And I think that's also an important thing to talk about, right? Is that people living with HIV deserve to be loved. They deserve to be in relationships. And they deserve to have healthy sexual lives, right? And they are able to engage in safe sexual lives and relationships, because if you take HIV medication on a consistent basis, then you can reach an undetectable viral load and not pass it on to your partner sexually or through injection. So that's where we are, right? That's it. So, unfortunately, like I mentioned, though, that even though we have these amazing advances in medication, we do have disparities, and they are concentrated in the South. This map showcases how there are severe disparities in access to HIV treatment services based on rural area. And so this shows how there are over 39,000 people living with HIV who live in what we call service deserts. So they are more than a 30-minute drive from HIV treatment medications and service providers. Many of them drive, like an example of Rocky Mount. People in Rocky Mount will drive an hour and a half to Raleigh or to Durham just to access medication and their services. Not only because they do have HIV treatment services in those areas, but the stigma prevents them from wanting to access those clinics because they don't want people who they know to see them.
If I can just jump in really quickly, I ain't gonna say a whole lot.
Because I got tall later. However, just thinking about what you just said and just really sharing some light on this. I work in HIV here in the state, and so I actually get to serve as one of the council members for the state as well, along with Ms. Esther. And one of the things about North Carolina is we live in a pretty good state for access, but because of stigma, people still will drive an hour and a half away from where they live just to get care. So North Carolina set up into 10 regions, where in every region there's an agency, a line-wide agency, meaning that people with no insurance can go be seen. Versus if you look at Tennessee, and you can see it right up there on the map, Tennessee, I can assure you, those case managers and even some of those people, and it's Alabama too, because of the ruralness of the areas, some of those case managers and people drive almost 2 hours or so across the state just to get access to other people that have care. And we've learned some of those things with some of the things that we've done over the CDC. But literally, these people are driving well across the states, and they don't have any margins. Like, even in Tennessee, and I'm gonna hush after this, you can still be criminalized for HIV in the state of Tennessee, even to this day right now. And so that stigma is so perpetuated. But in North Carolina, we have a pretty good system set up. It's important for us as faith leaders to get into this work and to encourage members and family members, the community to, hey, let's break some of these things. Let's get people in care. And let's love on folk for their humanity. And that's it.
Thank you, Dr. All right, and so in addition to this HIV service deserts, why else do we have these disparities among African Americans? It's because of the lack of insurance. Dr. McLean mentioned that there are many people who drive over an hour, 2 hours, even cross state lines to go access services. And many of these southern states, there are 14 states in the country who do not have Medicaid expansion. And Medicaid expansion would provide access to men who are often left out from accessing health care if they're unemployed or if they have an incarceration record. And so that is clearly one of the major contributors to this rise in the HIV epidemic in the South. In addition to that, we have what we call social determinants of health. I think most of y'all are probably familiar with this, but economic stability, instability, this kind of social drivers and economic drivers, health outcomes, economic instability, neighborhood and physical environment, right? So you're living in a community where you don't have easy access to the bus, or the neighborhoods are not safe, or things like that, or you live 2 miles away from the hospital, but the bridge, the state highway goes through your neighborhood and you can't get access to the hospital, right? Those are structural barriers. Lack of access to education, right? And so then that affects people's understanding of their health. It's not just about educational attainment, it's also being able to comprehend what the doctor is telling you, right? The food and food insecurity, not having access to healthy food options. Now, how might not having access to food make you vulnerable to HIV? Does anybody have an idea?
Yes. Some medication you have to eat to take the medication.
Yes. So some medications you have to eat to be able to take the medication. I would say another way is if you don't have access to food, you can't afford the food, then you may depend on someone. You don't have a car, you may depend on someone to take you to the grocery store. Well, that someone may ask for a favor. And that favor may be a sexual favor or a drug favor, right? And not the power dynamics. Right? And so that's, we have to think about it that way too, right? This overlapping intersections between economics, race, class, gender, right? Okay, so these are ways that are proven to help prevent HIV. HIV testing, not only just the testing part, right? I think that's a wonderful thing, and I think that's an easy and first step that all faith communities can implement is to do the testing. But what I want to see, and what the Faith Coordinating Center is working on, is to create a network of faith communities who also link those people into care. So whether you test negative or positive, you're connected into PrEP, the HIV prevention medication, to keep you from getting HIV. Or if you do test positive, that not only are you embraced by your faith leader and say, hey, it's okay, it's not this sentence, we love you, and let's go, let's do this, we have you. But also, here's who you can go to get access to medication and counseling, right? And transportation and housing, right? Antiretroviral therapy, the medications that you're talking about, that's the official name of them. Access to condoms and sterile syringes, prevention programs, educating people about HIV, prevention programs for people at high risk, substance abuse treatment, and harm reduction, screening and treatment for other STIs. Syphilis actually is on the rise in North Carolina. I don't know if y'all know that. Gonorrhea and chlamydia as well. And gonorrhea actually is and so those also make you vulnerable, and herpes also make you vulnerable to HIV. And many people have multiple infections. Screening and treatment is the end, and like I mentioned, pre-exposure prophylaxis. So there are many types of HIV medications available, and they depend on kind of the type of the strain of HIV you have and other comorbidities. If you have kidney issues, things like that. So that's where the doctor really is coming in to help you identify which medication is the best for you, if there are certain side effects that you want to avoid, etc. And this decision, and then also depending on how advanced your HIV is, I think that also determines what type of medication they're going to give you. And so it's based on the viral load, the T cells count, the strain, the severity of your disease, how far it's spread, other comorbidities, like I mentioned, and other medications that you may be taking. Many people living with HIV also have diabetes, and so those things kind of interact, right? But remember, even if you don't remember all of that on the left-hand side, remember that HIV is not a death sentence, that it can be prevented through sexual transmission if people take consistent medication. And people living with HIV are loved and deserve to be loved. There are many resources. So Dr. McLean mentioned Ryan White program. So for people who don't know, Ryan White programs is named after a man who died from complications with AIDS. And the program is a federal program that the government gives money to the states to cover HIV services for people who are uninsured. And so it gives you access to medical coverage, transportation, dental care, and mental health care, and housing. And so that is something that people don't realize, that it's not only is it not a death sentence, but there are services there to help you create a safety net for yourself. There's help with employment searches, and there's a Center for HIV Law and Policy. And so there are resources available. In addition to that, we have and are continuing to make advances on the medical side. So there are currently available treatments for people living with HIV. There's condoms. There's this is not as current as relevant in the United States, but male circumcision is also used as a way to help reduce HIV transmission. Syringe exchange programs and oral PrEP. We are working on a vaginal ring for women who want to also have alternative ways to protect themselves. It may be difficult for them to negotiate condoms, but they have the ability to use a vaginal ring without necessarily having to negotiate with a partner. A long-acting injectable, which I mentioned, could protect for up to a month to 2 months. And you can use that for prevention as well as for treatment. There's also, this is a little bit further down the line. This actually, they have broadly neutralizing antibodies. So they're working on vaccines. That's difficult because HIV mutates. And so, as we know with COVID, each mutation makes the vaccine less effective. Well, think about it takes maybe a few months for COVID to mutate and spread throughout the world, right? HIV mutates in the body every single time it infects a new cell in your system, right? And so it is constantly mutating, and so it is much more difficult to develop a vaccine, but they have figured out some kind of ways to use technology and DNA and things that I'm not a natural scientist, so I can tell you the basics, but they have figured out some ways to think about developing a vaccine.
Definitely also, could wait on you, could you have that? A lot of people notice that, so they gain a lot of weight.
They gain a lot of weight that as a side effect of HIV medication.
Some, but not that.
Yeah, y'all answer that.
Yeah, some of it, but when you think about the immune system, right? And when you think about what Dr. Mathews was talking about, that really, when you are depleted, HIV is mutating, it's affecting cells in your body. And the point is to get to a point where your immune system is good enough to fight against any infection that you may get. You may gain some weight. And it's not only with HIV medication, it's with other medications too. People gain weight. And that's also stigmatizing because it's to be a partner in your healthcare. Because it may be different for each person. And it may be other things, other factors. It may not even be HIV medication at all.
Because that is someone I knew that had it, and they gained a lot of weight behind it, and I didn't know if it was behind the fact of the medicine or, the HIV medicine they were taking. So that's why I wondered if does it put weight on them, because I knew they gained weight and they weren't as large as they were. So that's the question.
And sometimes it's just getting older.
Yeah.
I'm 61.
That's
Multiple
true.
things.
That's true.
So the other, I really don't have 2 minutes left. But the other thing that I want to mention is that there actually are 4 people, this slide is old now, but there are 4 people in the world who have been cured of HIV. Timothy Ray Brown was the first person who was cured. He had both HIV and cancer, lymphoma. And through research, we discovered that there's a genetic mutation of a certain group of people in Northern Europe who have a natural resistance to HIV. Basically, their immune cell does not have a certain receptor, it's called the CCR5 receptor, that HIV cannot latch on and then infect the cell. So they have, with Timothy Ray Brown and with Adam Castillejo, they got a stem cell transplant, bone marrow transplant from people who had that genetic mutation, and also gave them chemotherapy to deal with the cancer that they also had, and then infused them with this new stem cell transplant. And so that transplant taught their bodies how to regenerate their immune system without that CCR5 receptor. Amazing. Unfortunately, that is a very invasive, dangerous, and expensive mechanism to cure HIV, and so it is not replicable with the nearly 40 million people living with HIV in the world. But we have also identified Maureen Bullenberg and another person called the Esperanza patient, who is the first person of African descent. I believe she's from Brazil, but of African descent to have a natural ability to control HIV virus in her body, so it does not replicate in her body, it does not spread in her body. So that's what we call elite controllers. And so now they're kind of thinking about, okay, there's multiple ways that we can potentially think about what we call a functional cure for HIV. When we're thinking about it in the context of faith, a lot of times faith leaders talk about Jesus touching someone and healing them, right? But I want us to also think about ways of thinking about healing as someone being able to take the HIV medication and live, experience the Lazarus effect, and come back to life, right? And be able to live a long, normal life, be otherwise healthy, and not pass it on to their partner. That is also what we might call a functional cure or healing, right? And so thinking about reframing the way that we think about cure and healing within the context of faith, because a lot of times faith leaders discourage people from going to get HIV medication because they think, oh, if you just pray to God, it will go away. And so we need to also reframe the way that we think about and talk about faith, about healing in our communities. Okay, so the Faith Coordinating Center continues to do these types of trainings. We do them monthly. We just actually had one yesterday, which was phenomenal. It was on HIV and the Bible. So we actually went through biblical verses and talked about, you know, how it's typically been interpreted, and then also new ways to think about the way that we can think about interpreting scriptural texts. And these are with scholars. These are biblical theologians, academics who are informed on this, right? And so we do those kinds of trainings. We also talk about basics of HIV in the South, Black sexuality, queer womanist and liberation theologies, social media and communication strategies, nonprofit capacity building. We are here to help our organizations to get more money. The Faith Coordinating Center does give out grants, and so we actually just awarded our most recent cohort. There's 14 organizations plus 14 artists, and they are ranged between $25,000 to $150,000 each for 1 year. So, you know, this is the resources that we are putting into the community, and particularly our faith communities. But some success stories, we actually had one organization to apply for additional money and got an additional $100,000 based on the trainings that we did with them. So that's what these are some of our funding partners. Let me skip this. Two of them are, three are in our room, four are in our room today. And in addition to the grant making and the training, we also do some communication, national communication to address stigma around HIV. We have toolkits available for faith leaders where we have sample scriptures, examples for sermons, and litanies and other types of things that you can integrate into your worship services. And we have kind of videos that you can use as talking points. So let's see if I can play it here. Well, actually, I want to finish and show y'all some other things that we have. We did a conference in Dallas, Proclamation at the Intersections, which was phenomenal, where we had the National AIDS Memorial quote there, and we had, we recorded all of those sessions, so they will be online, and we'll be able to, I'll probably send it to Jessica and Elizabeth, and they'll send it out to the network for you all to be able to access all of the workshops recorded that we have. We also have a faith-based survey, so we want to get a sense of how many people, how many organizations in the country are doing any type of HIV work. It could be a World AIDS Day thing, it could be talking about a sermon, it could be testing, etc. So we want to get a sense of how many faith-based organizations are doing this work across the country or who are willing to and open to. And it's $25 to complete the survey. One survey per organization for a faith community. And we also have an HIV and Faith Ambassador program that we are launching. It is now full, so I apologize that we don't have space yet right now, but we have 50 faith leaders and 10 medical providers throughout the state of North Carolina who will be ambassadors. We're going through some trainings with them, and then they will be participating in a statewide campaign, so you'll probably see a lot on social media and the news and TV and radio where they're talking about HIV in their communities. And we also do a lot of national press. We did an open letter to this rapper Baby who said some homophobic, misogynist, and anti-HIV words at a concert, and it went viral and made some national news. And so we actually wrote an open letter correcting the statements on those, and then actually invited him to an educational meeting where he was able to learn from people living with HIV. And he's from North Carolina, so he's crazy. And then we also have a partnership with Lil Nas X, who has been gracious enough to help us raise over $500,000 additional dollars for organizations that went directly to those organizations in the South to address HIV stigma. And we have it, like I mentioned, that Faith Leaders Toolkit that's available, that's available on our website. And then we are launching the Black Faith and HIV website. So excited about this. It's really an initiative. I'm wrapping up. It's an initiative to do some self-paced online trainings for people You can go through self-paced online trainings and get certificates, and also get exclusive access to information about funding, and we'll have video and other kind of toolkits and materials that you can use to disseminate through your faith communities. And so we will be launching that, I believe, next week. So that concludes. I don't have time to show you all the wonderful videos that I have, but we also have these materials here that you can use on social media and throughout your communities for ways to destigmatize HIV in faith communities and ways that faith leaders can transform the story on HIV. So, thank you.